Good afternoon, everyone. We have joining us is Dara Baldwin, the Director of National Policy Center for Disability Rights. Dara, how are you doing today?
I am doing well, can't complain in this pandemic. You're just glad to be alive. So, and I just take every day as a new day. So, but thank you for asking.
Yes, it's important. I think during this season, like you just said, we're still in a pandemic, and you just got to ask folks, like, how are you? So, thank you so much for being with us. So, we have some, like I said, the work that you do is so important. And oftentimes not even represented in the conversations that we're having. And I'm glad that you're going to be able to kind of give us a lens into oftentimes people that, like I said, unfortunately are forgotten in our society. Um, so pre-pandemic, 1 in 4 Americans lived with a disability. So that's 61 million people. That's a significantly high number. And it's probably higher because probably some folks don't even want to acknowledge that. While we have the American Disabilities Act, it's far from addressing the variety of needs disabled persons need to survive and thrive in society. And Black and Brown communities not only have much higher disability rates, but are also negatively impacted by not only racism, but also ableism. Before we jump right into the impact of the pandemic, I want you to kind of set the stage as to some of the laws and policies and practices a disabled person of color inherited prior to COVID-19.
Sure. So thank you for asking, and you're correct. So let me just go on the data around the number of people with disabilities. So you are correct. The number is higher. And a couple of indicators will say that, right? You know, when you do research, right? It's your hypotheses. What is the question you're asking? Your methodology, how you're collecting that data, right? And the indicators around that data. And so the data you read came from the census. And many times people will not identify themselves with a disability, specifically Black and Brown folks. It's
Right.
still kind of taboo in our community to say you have a disability and to honor that disability. The second thing is sometimes people, when you're doing a census, is every 10 years, a lot of people have what's called episodic disabilities, like HIV and AIDS, or you may have had cancer. You are not cured from cancer. Cancer is in remission. And because your cancer person is surviving from the cancer and still living, you can use the ADA. But you may not have been going through chemotherapy at the time that you got the census for. And so you say, no, I don't have a disability. But 2 weeks later, something happens and you have to use the ADA to get what's called reasonable accommodations at work. You need, you need to work 4 days a week, or you need a special seat, right? Ergonomic seat. Well, you're calling on the ADA because you have a disability, but you filled out that form 2 years before, and said, no, you didn't have a disability. So the numbers are very low. The other thing is, remember, the census doesn't really capture children. And so the number of children in this country that have disabilities are never really captured, and then they grow to adults. So they might have been 6, 7, when it's 10 years later, they're 18, they're not in that number. So know that. And then the last thing is that you may not have a disability today when you filled out that census form and in the 10 years, but an onset of a disability can happen at any time to any of us, whether it be a physical disability, something that happens in your life. You get a diagnosis that you have MS, multiple sclerosis, which is also episodic. Those of you who watched West Wing, the president had MS at the beginning, then he couldn't walk at the end. It was those episodes where he couldn't move his body, it was episodic. So, but he had MS just 6 seasons before that. Things like that, or just as an accident or tragedy happened to you, which I had a friend literally going to work in Philadelphia. She stepped out, a bus hit her, and she became quadriplegic. Right, vibrant 28-year-old and everything. Now she's a vibrant, something, I won't say her age, quadriplegic, right? But she's a quad, right? She's no longer, that was her last day of walking on her own 2 feet. Right. And that was because of an accident, but still very much a vibrant part of the community. So I say that. The laws that protect people with disability are many, but I'll start with the history. And why it's so harmful, and why people with disabilities, as you said, are left out of conversations. Regardless, people will say they're doing equity, and I look at the equity plans and it has nothing to do with disabilities. That is not equitable. They are ignored when it comes to COVID, when it comes to pandemics, right? Remember, this is the United States pandemic. Pandemic's been going on for years in other countries, right? And everything, and they've been ignored, and we've seen this. The rollout of the vaccine, right? When it said that it's essential, disabled people weren't thought to be essential. I live in DC statehood, I have to say. And we had to fight to make sure that disabled people were at the top of that. Like, no, yes, seniors, yes, 65 and older, and if you have an underlying condition, but we were like, disabled, if they 15, if they're 25 because of the age, and they have a disability and they have an underlying condition, they need to be essential. They need to be at that front of that line. Because in 1876, this country in San Francisco, California, created what's called the Ugly Laws. A lot of people don't know. You can just Google them. Now you got a couple of professors who've been writing papers on them. And what the Ugly Laws basically said was, if you have a disability, you cannot be in public.
Wow.
You had to keep mostly it was children, you had to keep that person inside. So they weren't allowed to go to public parks. They weren't allowed to go to the carnivals and the parades in school. They weren't allowed to go, right? Keep them inside. And so that concept has gone through our, history. Now, of course, there's a whole lot before that around slavery and creating how they did what they did to the enslaved and making them disabled. But I'll just go with that law. That became a federal law. It moved up. And then the racist FDR and ableist FDR created the New Deal, who everybody thinks is so great. And what he did was take that law and say, hey, you know what? Instead of keeping them in the house, institutionalize them. Let's put them inside institutions. And so then you started seeing people with disabilities, because usually when you're born, like Down syndrome, you can tell immediately. Or later in life, things happen and they put them in institutions. And so because they have been erased from our society, when you start creating laws, you just look and say, oh, well, why? Well, the question always is, why would we do this for disabled people? That's the first question. And then the second question I always get is, well, how many disabled people are in the community? And what the ADA did, the Americans with Disabilities Act did, was create a civil right for people with disabilities. There were laws before that, and if you want to know, you can call me, I'll do training on it, but I'll tell you what the civil right means. When someone asks me that question, why do disabled people need it? Because in Title II, the ADA says, if you create a program for one group of people, you create it for all.
Yeah.
You have to create it for all. That's number one. Number two, it says that the basis of the ADA is not doors and ramps. Let me let y'all know. That's the Architectural Barrier Act of 1968 that said doors got to be wide and we got to have ramps. What the ADA said was community integration. Get those people out of those institutions and get them into the community. Or if they live in the community, then they need the services they need. What we believe, we come from civil rights, that all disability, no matter what your disability is, you have the right to live in the community. They have the right to be safe, education, housing, transportation, all the things that we have as a civil right. And I say we because I'm not a person with a disability. I'm a non-disabled person, but that is what a civil right is. There's also what's called treatment rationing. It is a form of rationing treatment, as it says. We knew, many of us, when they started this, we're going to start putting people in hospital. I was in public health and healthcare for 20 years before doing this job. So I understood and knew there weren't enough beds in this hospital to hold the people in this country. There weren't enough clinicians, doctors, nurses, hematologists, you name it, lab technicians. Ain't enough of them in this country to do this job. And third, they were going to go after the people who, quote unquote, they don't feel believes or needs to live, or they are a burden to society. That is always what we get, is that disabled people are a burden to society. And what treatment rations did, and we did see about 8 states around the country do this, and they are still doing it right now. Idaho right now is doing this because we're still in the pandemic. In November of 2021, you, Jane Doe, don't need that oxygen. You have a disability and you get oxygen, you need oxygen every day. They want to take her oxygen and give it to the 22-year-old strapping white male who he needs to live, but you don't need to live. So that's called treatment rationing. So before it even got started, we knew, and even though the Affordable Care Act, Section 1557, is the civil rights section, which many of us helped write, I helped write that section. we knew states were going to say, we're going to do this anyway. We don't care about your 1557. We don't care about your civil rights. We don't care about the ADA, what the ADA said. We don't care about the Rehab Act and what that says, that you can't do this to disabled people. They did it anyway.
Wow, I'm a little taken aback. I'm a little, and overwhelmed in a great way, because I feel like there's so much of this information, like I said, that just people just don't know. They don't even know the history about it. We know the history of a lot of different things, but oftentimes not really understanding the history around folks that live with disabilities. I want you to, if you can, just briefly, if you can help kind of define for folks like how we would define a disability. I think oftentimes people don't really understand that their a disability is. I think people, when they hear that, they think physical oftentimes, but they don't, that it's a bit more expansive. So if you could just kind of just briefly share kind of like what of the expansive definition of what is included when someone says, or someone can claim having a disability.
Sure. So in 1990, when they did the ADA, it was a very narrow definition, and it really said that like you have cerebral palsy, like you have this that they called it impairment. We don't want to say impairment because there's nothing wrong with having a disability, but they said you had this impairment. Then they had a couple of cases that went to court, Supreme Court in particular, and said the Supreme Court told Congress, you need to change this definition because it's not covering everyone. Also remember in 1989, before that, you had racist people like Jesse Helms and Strom Thurmond in Congress who weren't going to, who like, we are not including those gay folks in this, and that HIV and AIDS. We're not going to include that in here because it was the 80s, late 80s, right into the 90s to get this bill. So to compromise, you do things like, if you want to get something passed, that's what they did. So after the cases happened, the Supreme Court kicked it back to Congress. That's what happens. That's the whole three separations of power: litigation, legislation, White House then administers it. Then you go to judiciary, Supreme Court, and the Supreme Court sends it back. Kind of like with the Voting Rights Act, the VRA, they're saying you Congress need to fix that. And okay, so they said you need to fix this in the ADA. So in 2008, we reopened the ADA with a lot of work. You do not want to open the Civil Rights Act, especially with these Congresses, but it was a concentrated effort of bipartisanship, and we're only going to change these lines in the definition. Now the definition is a little broader, where it says, and I'm being very broad, but it says any condition that hinders your everyday life. So if you can't swallow, if you can't see, if you right, those are physical, but that was right. Even mental health wasn't considered a disability until 2008, which, as we all know, I don't care what anybody says, you have been affected by COVID. There have been some days when I said, I just don't feel like getting out of bed today. Right. That hinders your everyday life. Yeah. And so at some point in your life, we may be, disabled. That's why it says temporary disability or permanent disability. Yeah. And so, but that's really the key, the crux of it. If it hinders your everyday life, meaning that even like if you were vibrant and active and doing things, and then all of a sudden you're not, you may have things that are affecting your immune system that are slowing you down. That is a disability. Right. And by law, you can use the services that we have for disabled folks. And so that's the definition.
Thank you so much. Like I said, I think that's going to be just invaluable information for anyone. And so we know that there are folks in our community, so, cannot take the vaccine because of concerns around comorbidity. I can never say that word.
Comorbidity.
I'm like, it's always a tongue twister.
Comorbidity.
Yes. And other disabilities, right? So what are the necessary protections and community strategies that we need to be employing during this time to keep them safe? Because we know that they, some of those individuals cannot take the vaccine for those reasons.
Right. And there are some good public, so just so I'll say this, I am not a fan. We are as an organization as well, but fan of the public health model. The public health model is racist and ableist, but there are some good public health people out there. People look at me and I'm like, you can't create a concept called treatment rationing in public health and think that that's equitable or that that's not racist or ableist. It is. It comes from public health officials. When you, as a public health official, feel that every emergency room in this country needs to have police officers in there, that's racist, right? So talk to me about public health. But anyway, there are some good public health people out there. Interrupting criminalization is program done by Woods Evans and Miriam Cobby and Angia Ritchie at Berhane University are very much a part of that, where we address this, right? Not only in public health, but child welfare, right? Like the child welfare system is racist. So I say that so you understand and know. When it came time to roll out the vaccine, they in no way gonna look at disabled folks and talk to them. So COVID is a part of the SARS family, SARS 1, 2, 3, right? This is SARS 4. They've had SARS in China for years. And if you notice, since China started having SARS, they wore masks. Masks maybe become a part of our everyday lives forever. And people are like, when can we get rid of these masks? Well, in order to protect the people you were just talking about, people who have underlying conditions, people who may have comorbidities, we have to protect them. It's the same kind of concept as when you went to visit someone with HIV/AIDS. You had to put everything on, the covering and everything. It protects you, but it really protects them, because you could be bringing something into that room that would kill them immediately. Whereas it wouldn't kill me immediately. Like having a cold, where I could get over a cold because I don't have HIV/AIDS, but the person who's in the room who has full-blown AIDS, they could literally die from me sneezing on them.
Right.
So that's a concept you have to take now into the public, that we as a society are gonna have COVID among us probably forever. Yeah. And that we have to not only honor and respect disabled people who may not, like you said, may not be able to take the vaccine because of those conditions, but also are many people, specifically Black folks, who don't want to take the vaccine, right? Because I'm not here to do that. That's not my job. A lot of public health officers, but we have to understand that there will be people among us who are not vaccinated. You're going to have to take that into whatever it is you do every day, which I'm doing right now, and I'm figuring it out. Do you want to be in a crowded restaurant for a long time? Do you want to sit outside? I still have not gone to the movies. We're supposed to do this weekend, because being in a closed-in place with people for 2 hours that I don't know, is because in DC, you don't have to prove you're vaccinated to go inside, which I'm fine with. Okay, but that's for me to decide if I want to go in those places and be there. Do I want to wear my mask through the whole movie? Again, and that's for disabled folks who are in the room with me. We're going to have to keep social distancing. We're going to have to take on different things. We as an organization are deciding this, right? Because we used to get together for large national conferences, and people used to fly from all over the world to come to Washington, D.C. so that we could speak to our congressional leaders. That's why we had our conferences here in D.C. I don't know if we'll ever do that again, because so many of our members are people who can't get vaccinated, who may not want to get on a plane, may not want to get on a train and come to DC. We were on Zoom since 2017. We helped Zoom get started because I had people who could never leave their home. Wow. They were homebound because of their disability, whatever it was. And this is how they used to talk to their members on Congress. I'd bring my laptop and I said, okay, hello. And the staffers would be like, what is this? And I'm like, this is Zoom. And this person is in Texas, and he lives in your district, and he can't come here, but you need to talk to him. So like right now, we're going to have conferences that are hybrid, that are part Zoom and part in person, because all of our community is not going to get vaccinated, and they may not feel safe traveling and coming. So we're making those decisions. And now Congress is making those decisions, right? Those congressional buildings used to be open to everybody. They're no longer open to everybody. You can't just walk up in Congress anymore. 2 reasons: COVID and what happened on January 6th, security. But let's be real, the world has now changed. Our world has changed, and we have to change with it. And these precautions that we have, washing your hands, they still not saying about, because people are dirty and nasty. Wash your hands all the time when you come inside. All of this stuff is about being when I work in public, when I work in the hospital, the number one thing they said to stop spreading germs is to wash your hands. That was it. We had a hand washing program. Everybody had to take it, whether you were the president of the hospital or right to whoever. And so you had to do that. Social distancing and wearing a mask. And I even double mask on transportation. Like if I'm on a train, crowded subway. So this is going to be a part of our life. And it is to protect our fellow people who are with us, who usually most of them are going to just be disabled folks, right, underlying conditions. But then are also other people who just are not vaccinated, and COVID will be amongst us. And we need to learn to live like that. And this white supremacist, public health system doesn't want to talk about that. They want to talk about, right, how it is to quote unquote be normal, which is their life, not ours.
And like I said, people need to be thinking about that, right? As folks are getting ready to go back to work, as folks are being pushed to go back into the office, these are all these strategies. And then oftentimes, like you said, no one's ever thinking, well, what about the folks that have disabilities, right? We can't force them to come back into the office because that doesn't protect them, especially if they're not vaccinated, right? And putting them in a position to be around all those folks. So a lot of these layers, right? There's so many health concern layers, practical layers around, just movement and just being in spaces. So I think that what you're just sharing is going to be so helpful. What are three of the most important interventions that can increase vaccination for disabled persons? As you mentioned, there are going to be some that don't want to take it. There are going to be some, there are probably some that maybe have wanted to take it and maybe haven't had a chance. But what are some three important interventions that we could be doing to increase vaccinations for disabled persons?
Sure. So one is the fact of communications and how communications is done in the disability community. As I said before, Title II, if you create a program for one, you have to do it for all. So if you create a flyer about vaccination, then it has to be available in all kinds of formats. So if you do it in 12 point, which is what most of us print things at, some people need larger print. They need 42 because they can't really read it because of their vision or because of their developmental disability, whatever the reason may be. So we ask things to be put in large print. Braille is still used by people who are blind and have low vision. They might want it in Braille. You need to be prepared to put it in Braille or to put it in some type of format so that they can read it on their readers. If you're putting it in PDF, not all PDF is accessible. There's a way to figure that out. Talk to the Centers for Independent Living, who I work for, which are non-residential centers that help people with disabilities. You can Google us, the CILS, ILRU, Google that, and there's a map. And on the map, you click on your state, New Jersey, New York, and it'll tell you where the CILS are. By law, there has to be one in every state. There's many more. And we have one program specifically for Native Americans, so the Native American community can use them. So that's communications, how you do that. Or if you have a program, you need to have ASL interpreters, you need to have closed captions so that everybody understands what you're doing. So communication and getting the information out. Number two is to be flexible and understand that not everyone, especially people with disabilities, as we just said, they don't want to go to a crowded facility to take that vaccine because there's thousands of people there. Right. Which we have seen, and people have said no. Now it's kind of changing, but they would be better just going to their PCP, their primary care physician, or their health center that they go to all the time, and let the primary care physicians give it to them. And the third is another of being flexible is having mobile units that will go to them. As I was saying before, there are some disabled people, even before COVID, who could never leave their home because of their disability. They are homebound. Mm-hmm. And we haven't been allowed to do that. As the CILS, my CILS, Center for Disability Rights, is a vaccination site. And we were told, no, you can't go to those people's houses. Now that's changing because they wanted those numbers to rise. But right, if you bring the mountain to Moses, right, bring Moses to the mountain, that is how you will get things done. And so we need to be flexible and understand that your rigid public health model is not something that works for Black and Brown folks, and surely doesn't work for disabled folks.
Yeah, those are really, really good. I wanted you to also, we've been having conversations with different folks around, health and where people live, right? And I can imagine also with folks who, disabled persons, that whether you live in New York City like myself, right, or whether you live in a rural community, that the challenges are different for you. If you could, also just share with us how your organization considers those differences. What are some of those differences? And I'm sure the pandemic has also probably shifted and created additional challenges for those folks. But how are you thinking, like from a policy perspective or from interventions perspective, how to include those different experiences that those individuals may have?
So very good question. And just to answer, so the way in which my organization and I and many people that I partner with do our work is that we come from a lens of equity. If you start with equity, which means fair and impartial, you cover everybody. You don't have those problems. And I center my work right, and equity, and ending systems of oppression, right, and ending racism. So when I start from equity, what does that mean? When people, so right, when you're doing policy or rolling out a program, what I tell people is that if you're sitting down like we're doing, having this conversation, and you don't have disabled people at your table, or you don't have Black people, you don't have queer, LGBTQ, trans people, you don't have Muslim, you know, different faiths, different. If it's a homogeneous table, your product is wrong. If your program is going to be wrong, and you have to start all over again. But if you have a very vibrant, multiple groups of people who are multi-marginalized, right? It's not multiply. We don't multiply our marginalizations, but we got multiple marginal, right? There is an African-American transgender woman who was a refugee, formerly incarcerated, and disabled. All of them things in one person. Yes, they exist, right? And so they not only need to be at the table, they need to be leading that table. They need to be telling you how to use the resources and services you have. They need to be the ones at the forefront. They need to hear it from those disabled folks. And if we come from those spaces, understanding and knowing that, right, those people who are closest to the problem are closest to the solutions. And that is how we should do policy. That is how you should do programmatic. And it is not something that is done, even with these quote unquote progressive white folks who think they're doing stuff right. And will tell you, they've told us for years, you don't know what you're talking about. Your race is not involved in everything. And then you had the reckoning of 2020, where now, right, when you had these programs and we were telling you, you're not including equity. They always want to include equality. And equality and equity are two different things. That's why they're two different words. And I keep telling people that. And so when you don't come from that space of equity and of involving all people, then you have issues and concerns with your programs. And that's why your things are not working for those communities.
Yeah, man, I almost just, like I said, I was trying not to shout while you were talking. Because I was
we
like,
we've earned it, honey. We can shout all day long. We have earned the possibilities of whatever it is we want to do. Because these people are now, I will say, people are starting to, and let people know that this is the start.
Yeah.
The door has not opened. It is cracked. Let me be very clear here. It is cracked. Yes. And we got a whole lot of things, other things to do. And they think they're there. They think that they're at that space where they're helping us, and they're not.
Yeah.
They still need to be in charge.
Yes.
Right. Yes. And that's what's hurting us here is, as I say it all the time, we are trying to create a new world order. I'm not trying to move chess pieces on the chessboard. I'm trying to take them chess pieces off, turn that board over, and start this game again. Marginalized communities were asked to send representatives to the president's advisory board, and the white disability community chose to send a white man. Right? Every program they did around vaccination and everything, they were all white people on the panel discussions. That's why it's not being rolled out properly. And that's why it's not getting to the Black, Indigenous people of color who are disabled. It's because you still got white folks who feel that they need to be in charge of all of this stuff. And until they understand and realize that you can't be in charge of this, that we have to do this together, or basically without you, we can do it better.
I couldn't have said it better myself. Thank you so much. Literally, I think, like I said, for those of you guys that are watching this, like I said, I hope that you take these words and that you inherit them into your ethos of the work that you're doing. And as was said, like, just making sure that representation, and oftentimes the people that need to be representing the folks that are doing in a particular marginalized group are not oftentimes those like us. It's the individuals that are experiencing that type of marginalization. And if sometimes that is us, then we can speak for the community. But I pray that those that are watching will continue to put representation first in those spaces, and making sure that we're finding intersectionality in those voices that will speak for those communities. So thank you so much. This has been a pleasure. Like I said, I've just thoroughly enjoyed this conversation. And I know there's so many folks that will be enlightened by the work that you're doing.
Thank you. Thank you all. Please be careful out there. Thank you, Heaven, for your work, and Pink Cornrows and Shambhala, excuse me, and all of my friends and my sorors and my sisters out there. And please know we will get through this as a community.